why do you think the teenage pregnancy rate is rising in the Philippines?
One of the factors that actually contributes to the increased number of teenage pregnancy in the Philippines are the legal barriers among young people in terms of accessing adolescent sexual reproductive health, because
There are legal barriers?
Yes.
Is that in the law?
Actually, kahit po sa reproductive health and responsible parenthood law, yung ganong menor de edad cannot access those information, services, products for modern family planning kung walang parental consent. So may
May parental consent. All right. So in other words, they can access it as long as they have parental consent. Do you agree with that?
Kung hindi nagiging barrier, unfortunately, na document ng mga grupo tulad ng YPEER na dahil karamihan pala, Mareng Winnie, na mga kabataan ngayon ay nahihiya or hindi kayang maging bukas sa magulang nila.
Do you think that that provision should be removed from the law? That, you know,
it should really be eased. Kasi kung batang ina na or batang ama, obviously may sexual experience na. But although, in fairness sa reproductive health law, nandun naman na kailangan humingi ng parental consent unless already a parent. Pero for example, yung mga nabuntis
supposing the parents don't give their consent,
yun ang problema.
what are you going
to
do?
Diba?
Actually, isn't that some kind of a constraint on the rights of...
Actually, Tita Winnie, yun din yung mga rekomendasyon at mungkahi ng mga youth-led organizations na the same with HIV, halimbawa Senator Risa na dahil the existing law does not permit young people to access HIV services, for example. Testing, for example, we need to develop a mechanism wherein if the parents is incapacitated to provide parental consent, then there's someone coming from the medical social worker or coming from a healthcare worker upon thorough assessment at napatunayan ng isang healthcare worker na ang kabataang ito ay risky. At the same time, during the assessment, na nagmungkahi yung isang kabataan na risky siya at nakikipagtalik siya, then the social worker and the healthcare worker, for example, could actually vouch through proxy consent. So sana din sa
AIDS bill.
So sana ay masama din siya para at least
you mean to say it's now in the HIV bill that you don't have to have parental consent?
If a social worker or health professional can vouch for you.
Why can't we have that in the reproductive health bill?
As companion measure, it can be so.
Ikaw ang senador eh.
Opo. Pagdating po sa period of amendments, ay pwede po namin inipasok yun as committee amendments.
It's a catch-22 situation for the teenager. Here they are, you know, they want to have...
Yes.
And you know, and the advice of the parents is no, you cannot have sex until you are married. And what will
if they already had, right?
Kung magkakaroon ng ganung pagtatanggal ng kailangan ng consent ng adult o ng magulang o ng guardian para maka-access sa mga commodities na meron tayo, dapat may kaakibat muna na hakbang na ginawa tulad ng pagpapaliwanag ng maigi sa ating mga kabataan kung ano ang sexualidad o yung pag-i-engage sa sex. So, with the proper knowledge, that would provide guidance na sa bawat isa sa atin, even sa kabataan naman. And with that, maaari siguro malif yung sinasabi natin na siguro total aware naman sila na at proseso yun ang dadaan. And eventually, probably, we will get into that.
But do you think that there is a tendency to experiment more, you know, more fearless ba sila? Anong, you know, because I'm trying to find out why it's rising here and it's getting lower in our neighboring countries.
Philippine society perceive sex as a immoral.
A taboo.
It's a taboo thing. At yung mga kabataan ay hindi dapat pinag-uusapan. Yung sex kasi ito ay usapin ng mga mag-asawa, for example. Ang Pilipinong lipunan ay in denial na yung mga kabataan ay nakikipagtalik na sa murang edad. At the same time, ito yung
in denial.
Yung mga parents natin.
Para bang,
So technically, yung environment mismo ay hindi siya conducive na nakaka-apekto at actually it added to the burden for young people to talk about sex. Therefore, young people, most of the time, if they weren't able to learn that information, right information, correct information about SRH, it could be na mali yung impormasyon galing din sa mga pornographic sites, for example.
Yeah.
It could be,
pumupunta sila sa pornographic.
exactly. Kasi may mga access tayo, yung mga kabataan merong access sa social media, for example.
Or sa kapwa kabataan na
Exactly.
kulang din or mali ang alam.